Sjogren's syndrome is a long-term autoimmune disease that affects the moisture-producing glands in our body, and it can affect other organs, including your eyes. Dr. Gregg Silverman joins us live to discuss this further. Dr. Silverman, good morning to you. How common is this, and how does one come across this?
Thank God it's not very common. It's about 1% of the population, sometimes between 0.2 and about 1.5% of the population, mostly females. It's females about 10 to 1 over males.
So genetics, is this something that just can come over time? How do those two play a role?
Well, as far as over time, it seems to it's about middle age. So as you get older, certainly more people have it. So that's it affects people in middle age to older age primarily, although young people can get it as well.
So we talked dry mouth, dry eyes, any other symptoms, and how do we even begin that conversation with our doctor?
Yeah, cough, difficulty swallowing, redness in your eyes where you can't see. Sometimes there's a cough, a chronic kind of cough. It can affect other organs, but primarily it's the lacrimal glands and the glands underneath your tongue, those moisture-producing glands.
So is this treatable, or is this something that you're going to have the rest of your life, and how do you deal with some of the symptoms?
Yeah, but the problem is we don't understand it. It's a lot like a lot of the autoimmune diseases. We don't really understand what causes it. That is what the trigger is. So you don't have a specific treatment for it. So the answer is yes. Most of the treatments have to do with symptomatic treatments. Lots of fluid, dry eyes. If you have dry eyes, eye drops. Chewing gum, those kind of things, and also anti-autoimmune disease kind of progression. That is anti-autoimmune disease medications like steroids and other types of those.
And this is something that it's not a life-ending kind of diagnosis. This is something you can live with. It's just treating the symptoms.
That's correct. I mean, this one would not kill you. This is one of the autoimmune diseases that won't kill you, but can cause some real problems down the road if it's not treated appropriately, and sometimes can lead into other types of diseases. It may be the beginning of rheumatoid arthritis, or maybe the beginning symptoms of other types of arthritises.
Dr. Silverman, as always, we appreciate you. Sjogren's, that's how you pronounce that name down there on the lower part of the screen.
You did great, by the way, John. I was very nicely done.
Thank you. I appreciate it, sir. If you have a question for Dr. Silverman, send us a text at 361-855-6397. I do my best.